Over the past week, New Hampshire has seen what much of the rest of the country is experiencing, an increase in COVID cases. The state's 7-day average has gone up, active confirmed cases are up, and hospitalizations have been creeping up as well. Why is this happening? Are vaccinations the only way to get out of it? And what will the fall look like? To answer these questions, we're joined by state epidemiologist Dr. Benjamin Chan. Dr. Chan, thank you for being on Close Up.
My pleasure, and good morning.
Good morning. Let's start with the Delta variant. Is this to blame for a spike in cases in New Hampshire?
Absolutely, and the Delta variant is to blame for a spike in cases across the U.S. and across the globe, really. This is yet another, the Delta variant is yet another variant of concern that has emerged during this pandemic, and the estimates are that it's at least or about twice as infectious and easily spread and more easily spread compared to earlier variants that we've seen. And so this means that it's going to be harder to control. It's going to spread more easily between people, and we're going to see higher numbers and more surges in the pandemic due to this variant.
Last summer at this time, when there were no vaccinations yet, there were actually fewer active cases. So how can that be?
Yeah, so what was occurring last summer, the situation last summer is very different from where we are now. If people think back to last summer, we were just coming out of a stay-at-home order. Many places around the country were coming out of stay-at-home orders and lockdowns and shelter-in-place orders. And there wasn't a lot of, or there wasn't as much travel or cross-border movement. The higher risk activities were at a minimum, and so we find ourselves in a very different situation now. And so, well, yes, we have the vaccine, and a high or large percentage of our population, particularly in New Hampshire and New England, that has been vaccinated. We also have now this more infectious Delta variant, and we have people that are traveling more, going to locations and participating in activities that may be at higher risk for exposing themselves or exposing others to the virus. So it's a very different situation. But I think a lot of this increase we're seeing now, mid-summer, is really due to the Delta variant.
Let's talk about masks now. The state had a mask mandate. That's gone now. So it's really up to people right now to make their own decision about masks. Right now, is your advice to Granite Staters to wear masks when they're indoors? And does their vaccination status factor in?
Good question. So the previous mask mandate was under the state of emergency and the executive orders, which are no longer in effect. And so you're right that there is no mask mandate. But because of the high levels of COVID-19 in our community and in the region, it's still important for everybody to take steps to protect themselves and prevent spread of COVID-19. And so face masks are one way of doing that. They're one layer of protection, in addition to other things we recommend, like physical distancing still, and avoiding high-risk super spreader events and locations. But at the end of the day, the primary way that we have to control this virus is vaccination. So first and foremost, it's important for people to get vaccinated, and if they're not fully vaccinated, to become fully vaccinated. But because we have a high level of spread of COVID-19 in our community, it's important for everyone to continue to take steps to protect themselves and prevent the spread. And that should be looked at in a multi-layered fashion, including people continuing to practice physical distancing, continuing to avoid high-risk locations, and yes, continuing to wear masks when in indoor public locations. And this is particularly important for people that are either unvaccinated, people that may have a weakened immune system and are at increased risk for severe disease, or people that may be fully vaccinated or have a family member or a household member who is either unvaccinated or at increased risk for severe disease. So it's important to look at this in the context of a multi-layered approach, but by and large, the most important thing that people can do is go get vaccinated.
School starts in a lot of New Hampshire communities in just a few weeks now. What's your advice to superintendents trying to figure out masking and spacing this school year? And does it also depend on the ages of students, since some are still not eligible for vaccinations?
Yep. So we've been working with schools to help them understand the guidance that's out there and implement layers of protection or layers of prevention strategies in schools. So we had a conversation with schools a couple of weeks ago. We're going to have another conversation with schools this coming week where we're going to talk about recommendations and guidance that's out there. But face masks are, again, one layer of protection that need to be looked at to be implemented in schools. We're going to have more advice and recommendations for schools this coming week, so stay tuned. But certainly there's a role for face mask use, face masks to continue to be recommended in schools, given the potentially large percentage of people that are unvaccinated or not yet able to be vaccinated because they're not eligible for the vaccine yet. We continue to recommend and base a lot of our recommendations on the level of community transmission or the level of COVID-19 in communities. And so, on our call last time with schools, there was a request for more information, more metrics potentially for when schools should consider implementing more strict measures. And so we're going to try and provide some of that information on our school call this coming week.
Sure. At last check, fewer than 60% of Granite Staters had received their first dose, just over 50% fully vaccinated. A lot of people apparently still wary of the vaccine. Can you talk about its safety and efficacy?
Yeah, so one way we've been looking at these percentages is also by looking at the age eligible proportion of people that have been vaccinated, right? So the numbers you quoted are absolutely right when you look at the population as a whole, but many of those many people may not yet be eligible for vaccination. So when you look at the age eligible population that has been vaccinated, those numbers are closer to 70% with at least one dose and 60% fully vaccinated. So a little bit better, but there's still a long way to go to getting vaccine out into our communities and getting people vaccinated. We continue to stress the importance of vaccination as the primary way to protect oneself and one's family and control this pandemic. We've been using these vaccines now for months. They've been shown to be very safe and highly effective, even against the Delta variant. And to put some numbers to that, there have been some early studies that have been looking at vaccine effectiveness against the Delta variant specifically. 2 doses, for example, of the Pfizer vaccine have been estimated to be 88% effective at preventing infection, whereas 1 dose of the Pfizer vaccine is maybe closer to 35% effective. So that highlights the need for people to become fully vaccinated if they've only gotten 1 dose of a 2-dose series. But vaccination is the way that we're going to control this virus long term. So we believe it's safe. We believe it's highly effective, and it's important for people to go out and get vaccinated. One of the things we're looking at doing is trying to get vaccines and make them available more at the point of care, where people maybe normally seek health care, where people conduct their daily lives. If people have concerns about the safety and the effectiveness of the vaccines, we will continue to try and put out accurate, reliable information, but we encourage people to also have a conversation with their trusted healthcare providers to address any lingering questions or concerns that they may have.
Well, there's a lot of talk now. We've heard about booster shots. This week, Moderna said because of the Delta variant, some type of booster might be needed. What are your thoughts on that?
Yeah, some type of booster might be needed. I think that there's a general recognition that could be the case. There is no recommendation yet for a booster dose for any of the 3 currently available vaccines. This is an active area of investigation. But before a booster dose would be recommended, it would have to go through the review process by the FDA to either authorize that vaccine for use as a booster or to gain full approval or licensure of that vaccine. And that's a process that's still being worked out. But I think likely in the future, there will be at least certain populations or certain groups of people that will be recommended for a booster dose, particularly people that may have a weakened immune system or are immunocompromised. But booster doses are not yet recommended, but I think possibly, very likely, at least in some groups in the future.
We have time for just one more brief question. So I want to ask you, are we getting to the point of having a population of vaccinated versus unvaccinated where life may be different for both?
So the goal is to not discriminate against people or to treat people differently based on vaccination status. Right? I think the goal is to get everybody back to normal life. That is going to take getting more people vaccinated, and so the goal is going to be to continue to stress the importance of vaccination, the safety of vaccination, and the high efficacy of vaccination, and to try and get more and more people vaccinated so that we can have everybody get back to more of a normal life and to continue to make steps to exit from this pandemic.
Sure. And I actually also want to ask you, the CDC recently recommended that vaccinated and unvaccinated people wear masks indoors and outdoors in areas with substantial or high transmission, and there are some communities in New Hampshire that fall under that. Are you falling in line with the CDC recommendations for those communities that have that high or substantial transmission, or do you have a different recommendation?
Yeah, so we have always based our recommendations on community risk based on the level of community transmission. So even going back to May, for example, when levels of COVID-19 were still high, and we continued to recommend at that time that everybody continue to practice social distancing, physical distancing, and wear face masks until the levels of COVID-19 came down. And then once the levels of COVID-19 decreased, we recommended that everybody could pull back on mitigation measures. And so with the levels increasing, certainly in areas with substantial or high community transmission, we continue to recommend that everybody take steps to protect themselves and their community, even people that may be fully vaccinated. And that can include the multi-layered approach that I mentioned, the physical distancing, avoiding high-risk settings, and yes, even face mask use. And I would stress again that face mask use is particularly important for people that may be at higher risk for COVID-19, are unvaccinated, maybe they have a weakened immune system, or are living with somebody that is at an increased risk. But we continue to need to take a multi-layered approach to preventing spread of COVID-19 to bring the numbers down. But again, first and foremost, in importance is getting people vaccinated.
Dr. Chan, thank you so much. Always great talking with you. We appreciate it.
My pleasure. Thank you.